IUI versus IVF as your first step when you're just getting started out, especially if you have a diagnosis of unexplained infertility. You need the right information to make informed strategic decisions about your treatment path. This is why my book, The Lucky Egg, includes figures like these to illustrate the pros and cons. Here's what you should know before deciding between IUI or IVF. First off, medicated IUI is a lot more laid back. Like I said earlier, it is kind of mirroring what you're already doing on your own, just augmenting things on both the egg and the sperm side. So it's not as burdensome as IVF. There's nothing that invasive about it. You're really just taking the pills for 5 days and then coming in for an ultrasound. We may give you an injectable medication, often that the nurses themselves can administer for you, that will make you release the eggs in a timed fashion. And even the insemination kind of feels like having a pap smear. It's not a big surgery or anything like that. There's definitely no anesthesia and it's not painful. But with that comes laid back success rates. So in comparison to IVF, it is not that efficient or effective of a treatment option. But if you're doing multiple, your cumulative probability can get to an acceptable level. And that's why we often talk about knowing when to fold them after doing several IUI rounds. If you're able to make high quality embryos with IVF, you tend to get pregnant quicker, right? If you have a euploid healthy embryo with a good grade, typically we say there's like a 60 to 70% chance of achieving a live birth from one transfer, which means after 3 transfers, your cumulative success rate approaches 95%. It is more effective with a shorter time to pregnancy than medicated IUI. IVF requires more of the patient or cost associated with it, and it is more of a burden to the patient. But in addition to getting you pregnant faster, it can offer several key advantages over IUI. One is by selecting out an embryo that is healthy for transfer, you know it has the right number of chromosomes based on the testing, you are lowering the risk of miscarriage. The number one cause of miscarriage in the first trimester is having an embryo that implanted that had the wrong amount of DNA, missing or extra chromosomes. So by weeding those out, you are reducing that risk. You're also increasing the confidence to put back one embryo at a time. And so the risk of twins is actually lower than what you'll get with medicated IUI. If you're only transferring one embryo at a time, it is very rare to have twins unless that embryo splits, which can happen around 2% of the time. When it comes to medicated IUI, you can't control exactly how many eggs that are released actually get fertilized and actually implant. And so the typical rate of twins that we'll quote to patients who are taking oral medications like letrozole or Clomid alongside IUI treatment is around 3 to 8%. And one of the biggest differentiators that really push people in one direction or the other when they're thinking about what they want to do as their first step is the ability to take the opportunity to preserve your fertility by freezing extra embryos with the process of IVF. Obviously, medicated IUI is all about the here and now, trying to get you to be more likely to get pregnant now, but it can't allow you to preserve for the future. So particularly for people that are pursuing this over the age of 35, especially over 38, and they know they want to have multiple children, it may make sense to think about IVF as a first step. It can be a really convenient reproductive hack, so to speak, to get around the biological clock so that you can still have a great chance at building the family of your dreams, regardless of when you got started.